Namaste. Welcome back to SLG Hello Doctor, the fortnightly talk show for health-related intelligence. In this episode, we will be talking about a very sensitive topic. There's nothing quite like the tender, silky skin of a newborn baby. But nothing also like the crankiness of a baby whose delicate skin is irritated by diaper rash, cradle cap, or any other skin condition. Many tiny tots are susceptible to skin irritation in their first few months, giving parents a rough time literally. Today, we will be learning how to care for the sensitive skin of babies from Dr. Prayaga Jyothsana, consultant pediatrician at SLG Hospitals, Hyderabad. Welcome, Dr. Jyothsana. I'm so glad to have you back here with us on SLG Hello Doctor.
Thank you, Priya. I'm glad to be here with you now.
Shall we begin, Doctor?
Yeah, sure.
Doctor, how is a newborn baby's skin different from that of an adult's or a grown-up child's?
This is a very important topic because many of the mothers in their background, once they become mothers, they have to take care of the baby's newborn skin. So as we all know that newborn skin is very tender. So the basic difference is in the epidermis of the newborn, it is 20% thinner. So there is a chance of increased water loss from the skin in the newborn babies. And the cell attachments that are there, and in the dermis we have some collagen and elastin fibers, they are also loosely attached. So there is an increased chance of any minimal injury will also result in erythema or blister formation in them. And we also know that newborn babies, especially the extreme preterm babies, premature babies, they are wrapped in the polythene bags or plastic wrappers because to prevent the epidermal losses. As I told you, the epidermis is very thin, there is excess water loss, so more so this is common in the premature babies. And we also know that there are melanocytes in the epidermis. So these melanocytes are also very less in number in the newborn babies, so they become more highly photosensitive. And the other thing I want to mention regarding newborn skin is they have a body surface area is more when compared to the body weight. So what happens is any external applications that will result in the absorption to the skin and can result in systemic toxicity also. So lot of using creams or any antibacterial soaps or any drugs application that can penetrate easily into the skin and it can result in systemic toxicity also. And the other thing, important thing is we have like sweat glands in the skin. So whenever there is any temperature regulation, these sweat glands, they play important role. So in the newborn babies, what happens is there are very less eccrine glands, so they will not be able to sweat. So this results in them thermal stress. That is, they can't maintain the temperature properly whenever they are exposed to high temperatures. So this is also one more difference in the skin of the newborn.
Doctor, is there any way to assess the sensitivities or skin type of a baby so that parents can take precautions right from the start?
So if we observe the baby's skin, the three important parameters are dryness and scaling, and the other is the erythema and excoriations. So depending on these three, that is dryness, how is it mild, moderate or severe, we have gradings and points are given like 1, 2 and 3, and depending on the erythema as well as excoriations also we have gradings. So if the cumulative score is more than 6 or if the individual score is more than 3, then we can say that the newborn skin is compromised and they are more likely to get infections or they are more fragile, their skin is fragile and the mother has to take proper precautions in such babies.
Doctor, as you said, every baby has excoriation or peeling off of skin. So do they get any immediate care in the birth room?
Immediately after birth, every baby, when the baby is born and the baby is brought under to the warmer, we just gently wipe the baby with a pre-warmed soft cloth. So there is no need of using any towels or rough objects to clean the baby. It is only the gentle cleaning of the baby is the most important thing with a soft cloth. And then what happens is the meconium or the blood stains that are present on the baby, they will be removed as usual. They have to be removed normally. And the baby is also protected from a vernix layer. So that need not be removed in all babies because it acts as a moisturizer to the baby. That can be left intact and it will peel off in due course of time. It becomes dry and it gets peeled off. This is a vernix. But we need to remember that in certain conditions, like where blood-borne infections are there to the mother, like HIV or HBsAg, then removal of this vernix is also becomes important. So this is the immediate care what we give to the baby. So once the baby is just cleaned with a pre-warmed soft dry cloth, the baby is immediately wrapped into the cloth and swaddled and given to the mother as well as to the skin contact with the mother.
Doctor, there are so many versions about when to give a bath to a baby, how to actually bathe the baby, what things to use while bathing the baby, for how long that procedure should be for. So can you simplify all this for us and give it to us in a nutshell?
So the first baby bath, it is a most important question. It remains in the minds of mothers also. They will be asking as soon as the delivery is done, so when my baby has to be given bath. So coming to this bath, actually once the baby is hemodynamically stable, we can give the bath. So it is usually on the second or third day. But the ideal way is to bathe the baby after the cord gets separated. But it takes around 1 to 2 weeks to get the cord separated from the baby. So because of some religious purposes, if the baby requires bath, we can give the bath on the second and third day, but not less than 6 hours. And another important thing, in preterm babies or those who are low birth weight babies, we generally defer bathing till 2 weeks or till they attain a weight of 2.5 kg. And coming to how long the baby has to be given bath. So mostly the duration should be very short. Within 5 to 10 minutes, the baby has to be given bath. And the other important thing is the baby should be given bath either by the immersion tub technique or the traditional way, what our grandparents used to do to us, keeping the baby on the floor on the outstretched legs and giving the bath. So this is also we can continue when compared to sponge bath or cloth bath. And the other important is the water should be lukewarm. It should be around 38 to 40 degrees. And so we can just keep our elbow into the water and see if it is comfortable, then we can give bath to the baby. And the other important thing is the surroundings where the baby is giving bath. Also the temperature should be maintained 26 to 27 degrees. So that we need to close the doors and windows and to maintain the temperature, especially in the winter season where there is loss from the skin to the surroundings also, conventional loss of water and conventional heat loss, so that babies will not become hypothermic. So this is another important thing they have to keep in mind. And how frequently they have to bath. This is also one more question. Is it enough to bath once a day or twice a day? This is also an important thing. We can do initially in the first few days, as the baby is very much, the baby will be with the mother itself. So initially it is okay to give 2 to 3 times a week also, depending on the temperature, atmosphere or weather conditions also. But once the baby becomes more active, as the days pass on, the baby becomes more active and dirt gets collected or baby is exposed to dirt. So it is always better to give daily bath. And one important thing is, even the evening bath is also important because it gives a very much calming effect to the baby, and the sleep pattern will also be excellent in these babies who are given bath even in the evening times. While bathing, this is the important things they should keep in mind.
Given the sensitivity of the newborn skin, what kind of soaps or cleansers would you recommend? What should they contain and not contain also?
Yeah, that is also more important. Among the soaps and detergents, it is always better to go for the liquid cleansers and detergents. These are better because they are very gentle when compared to soaps. So most of the soaps, they contain chemicals which may cause irritating to the baby's skin, like sodium lauryl sulfate. They use different chemicals which cause irritation to the skin of the baby. So if at all, but nowadays there are soaps which are mild and gentle coming even to the baby. So these soaps can be used, but never use alkaline soaps or glycerin soaps. They have more chance of contact dermatitis. So it is always better to use liquid cleansers which are very much gentle and they are baby friendly.
Let's take a short break on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG హాస్పిటల్స్
4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ JCI అండ్ NABH ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స,
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స,
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ICU బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు,
3 టెస్ట్ల MRI, CT స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక SLG హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133399500,
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678.
ఆంధ్ర ఆరోగ్యశ్రీ సదుపాయం కూడా కలదు.
Welcome back to SLG Hello Doctor. Today we are in conversation with Dr. Prayaga Jyothsana, Consultant Paediatrician at SLG Hospitals, Hyderabad, and we are talking to her about newborn skincare. Dr. Nappy rash is a dreaded issue for every mom. So how does one take care of that area and how can one prevent nappy rash from happening?
Nappy area, the cleaning of nappy area is also important. It has to be cleaned as and when the nappy area is wet or soiled, or minimum 6 to 7 times in a day the nappy area has to be cleaned. So can we use the wet wipes that are available nowadays in the market? So it's okay to use the wet wipes, or else even a soft cloth is very much good to clean the nappy area. So the nappy area has to be naturally, it has to be cleaned just with a simple wipe or with a cloth, gentle soft cloth. If there are any meconium stains, or if there are any the skin is dry, then you can use a liquid cleanser in that area to just remove those stuck stools. And the nappy area has to be dried to the air normally. So it has to be never in the wet condition. Air dry is best to keep that area safe.
Doctor, can we use moisturizers or emollients to keep baby skin smooth and soft?
We can use the emollients. Basically, it is always better to apply the emollient immediately after bath. And whenever there is a family history of atopy or allergic dermatitis, then it is always better to apply twice or thrice in a day to the baby. And also, depending on the skin condition, as I told you, like if there is any excessive scaling or peeling of the skin is there, excessive dryness is there, so in order to prevent that, emollients will act as a better barrier and they will soothe the baby's skin.
Doctor, massaging the baby is a huge ritual in India, and mothers take a lot of pleasure in the amount of time spent on bonding with the baby as they do it. Now, what kind of oils should be used for it to be most effective?
The massaging, as we all know, it's a traditional method. If it is performed in a smooth and better way, it is very good to the baby. It increases the sensory system of the baby, it gets well matured with that because of the massaging. And also there will have less number of colicky pains. They'll have proper digestion as we massage all parts of the body like abdomen, legs and all. They will pass the flatus easily. They don't have any colicky pain and the skin gets stimulated. And during bathing, eye contact with the mother and also the mother's contact, and the baby will hear the songs that are sung during massaging, and all this will give a good bonding to the mother as well as a good sleep pattern to the baby. So those babies who are properly massaged, they are a little fuzzy. They they are more calm when compared to other babies. So coming to the oils, what oils we need to use? So it is always, there are different oils, like some people will use mustard oil, olive oil, sesame oil, or even coconut oil. But the studies shown that coconut oil and safflower oil, they are very much baby friendly and they can be used to any baby. But with the olive oil and mustard oil, we have seen some contact dermatitis. So they are not good for each and every baby. So, and also the kitchen vegetable oils, they should not be never used because they oxidize easily and they cause chemical irritation to the baby's skin. So it is always better to use the age-old traditional coconut oil or the safflower oil. And the mineral oils what we are getting, or the synthetic nowadays we are getting oils. So those are also mild oils which can be used for massaging.
Doctor, we've covered pretty much all there is to know about skincare. Let's move to scalp now. So the baby has very silky and fine hair. Also the scalp is very soft. So how does one care for both these?
So coming to the scalp area, even the same liquid cleanser can be used for cleaning the scalp of the baby. But some ask regarding shampoos. So if there is a need for shampoos, then it is always better to use the shampoos which are having the pH that is equal to tears of the eyes, so that it will not cause much irritation. And also these shampoos, they should be free from fragrance, free from anti-inflammatory agents, as well as the pH should be equal to the tears. And a few babies, they require repeated shampoos because the scalp also becomes very scaly, like in cases of atopic dermatitis. Babies, those who are prone to atopic dermatitis, they have lot of scales, and these scales sometimes they get fixed to the scalp. So it becomes very difficult to remove them. So in such cases, we can use the gentle mild shampoos.
The umbilical cord has come into great prominence in recent times with the buzz around stem cells. So is there any umbilical cord related care given in the delivery room for the baby?
Immediately after delivery, generally once the baby comes, we cut the umbilical cord with a clean sterile scissors or the surgical blade. So in such cases, even there is no need of application of any antiseptic also for the umbilical cord. But in some home deliveries or in some rural areas where the sterility is not maintained, in such cases we apply chlorhexidine to the umbilical cord, and whenever it gets soiled also we need to clean it with soap water. So there are certain rituals to apply some milk or cow dung or vegetable matter to the, or some herbal haldi like that to the umbilical cord, but these are not essentially required and they are banned also because that can result even in the sepsis to the baby. And also we need to know the early signs of omphalitis, that is whenever the umbilical cord, from around the umbilical cord, if we find any redness, erythema or any edema in that umbilical area, or some purulent discharge, foul smelling purulent discharge coming from that umbilical cord, then it is an early sign of omphalitis, because that can go systemically and can result in sepsis to the baby. So immediately in such conditions the baby has to be brought to the doctor.
Thank you, Dr. Jyothsana, for clearing the air about skin care and hair care for newborns. We're so grateful for having you here with us.
Thank you, Priya. Thank you so much.
Viewers, we'll be back with you in 2 weeks from now. See you back here happy and healthy. Namaste. Viewers, don't forget to hit the bell icon to keep yourself updated on all that's happening at SLG Hello Doctor.